Okay. Hello everyone. Today I'm going to discuss about the abdominal examinations. So this is also one of the important physical examination during the diagnostic assessment. So in this topic, I'm going to discuss about the anatomy and physiology of the abdomen, small about the brief history and also brief anatomy and physiology of the abdomen, identifying the quadrants, regions, and landmarks for the abdominal assessment. So how we are going to divide the abdomen into the quadrant regions, and also correctly perform the techniques of inspection, auscultation, percussion, and palpations. So these are the major physical examination techniques. The four techniques are inspection, auscultation, percussion, and palpation. How we are going to perform on the abdomen and differentiate the normal and abnormal findings. What are the abnormal findings? How we are going to document during the assessment. So first, about the anatomy of the digestive system. So on the abdominal, so this digestive system is going to start mouth, from the mouth to until to the anus. So if you see this one is the digestive tract, is going to be the mouth and also about the pharynx, and it's going to be the esophagus. This is a food pipe is going to connect it to the stomach. So this stomach is connected to the small intestine and large intestines, and finally is going to the rectum and anus. How is going? So what are the contents are there? What are the organs are there in the stomach? We are going to discuss here. So if you see the process of digestion and eliminations, so the process are going to starts in the stomach, in the mouth, so it's end in the anus. So it's going to from mouth to esophagus, stomach, small intestine, large intestine, rectum, and anus. Whatever we are going to take the food. So the food is entered into the mouth. So here it is going to be with mixed with the saliva while chewing. So that is going to swallowing. So through the like a bolus formation, it takes into the esophagus due to the peristalsis movements. So after reaching the esophagus, from the esophagus again it's reached to the, so because of the smooth muscle contractions, the food moves from the esophagus to the stomach. So in the stomach, the digestion takes place with the enzymes, help of the enzymes and also acid and also mucus. So the food is going to be digested, it make as a chyme. So that is going to be like a liquid form. So there is going to enter into the small intestine. So here again, the whatever the nutrients are there from the stomach is enter into the small intestine. So there they are going to be absorb the nutrients from the small intestine to the bloodstream. Again is going to be send all the waste materials or the digestive material, the chyme material is going to large intestine. So there again the reabsorption is going to be reabsorption takes place. What are the water and minerals are going to be reabsorbed there again. So the waste material, everything from the large intestine is going to the rectum to the anus, then excreting. So these many stages are there from mouth to esophagus, stomach, from the stomach to small intestine and large intestine. From the large intestine is going to the ascending colon, transverse colon, and descending colon, and is called as the rectum. From the rectum is comes to the anus. So there is an excretory path. So this much of so many stages are there in the digestion process. So what are the associated organs in the stomach? So if you see in the abdomen, so the major organs in the digestive system, liver, gallbladder, and stomach. So these are the associated organs in the digestive system. So their role is also very, very important in the digestion. So if you see the regions of the abdomen, so it divides into the three regions: epigastric region, and also umbilical region, suprapubic region, are also called as hypogastric regions. Supra means the superior, above the pubic region. Hypogastric means hypo means the below, downward. Anything we can call this one, but we are going to divide the parts like divide the quadrants. So if you see here the three regions, epigastric, so at the gastric level, so that's the stomach level. Umbilicus at the umbilical and navel level. Hypogastric means below the gastric, the stomach, are also called as suprapubic. The pubic bone is there, that is the hip bone. So above the bone is called as the suprapubic, also called as hypogastric. So again, this divided into the right and left, like a hypochondric region. Hypochondria means the about the this area is divided into the right hypochondric, where the liver is going to be situated, and also left hypochondric region. So again, this one is going to be the umbilical region is going to divide into the right lumbar and left lumbar. hypogastric level are also is a suprapubic is going to divide into right inguinal and left inguinal. Total 9 regions. The abdomen is going to divide into 9 regions: right hypochondric, epigastric, and also left hypochondric. Right lumbar, umbilical, and left lumbar. Right inguinal, hypogastric, and left inguinal. So these are the 9 areas. Are this stomach is the abdomen is divided into the 9 regions. So these 9 regions, what we are going to found, what are the organs we are going to find? So they according to the surface. For example, if see in the right hypochondric region, so what are the right lobe of the liver, gallbladder, part of the duodenum, hepatic flexor of the colon, upper half of the right kidney, suprarenal gland. So these structures are is present in the right hypochondric regions. And also next about the right lumbar region, ascending colon, lower half of the right kidney, part of the duodenum and jejunum. So these parts are there in the is the right lumbar region. So these are the lumbar region, right hypochondric, right lumbar region. So coming to the right inguinal region, so is going to be cecum, appendix, lower end of the ileum, right ureter, also right spermatic cord, right ovary is going to be located in the right inguinal region. So these are the is the right side one. And also the epigastric region, at the epigastric region is aorta, and also pyloric end of the stomach is a part of duodenum, pancreas, and also part of the liver is also going to be located in the epigastric level, these regions. So coming to the umbilical region, you can see the arteries are also we are going to form. So is the omentum is there, mesentery also there, lower part of the duodenum, and also part of the jejunum. So this is also going to be, and also ileum. So these are going to be located in the these are going to be located in the umbilical regions. So coming to the hypogastric level, so hypogastric level is going to be ileum, bladder, and also uterus are going to be found in the uh, at the hypogastric region. Left hypochondric region is going to be stomach, spleen, tail of the pancreas, the splenic flexor of the colon, upper half of the left kidney, suprarenal gland. So these are going to find in the is the lower, left upper upper hypochondric regions are the structures are going to be located there. Left lumbar, descending colon, lower half of the left kidney, and part of the jejunum and ileum, and also left inguinal is sigmoid colon, left ureter, left spermatic cord, and left ovaries cord. These structures are going to found in the all the 9 areas. So why we have to know all these things means, according to if we while palpating, if they're having any like a tenderness or any dullness, so if any like a pain, if they complain, so we can get the some clue it's related to the particular structure or the structures which is located in the particular area. So that's why we have to know what structures are there in the all these 9 areas. So coming to the, if you divide into the, these are the organs, what they are there. If you divide into upper, right upper quadrant, and also left, right lower quadrant, left lower upper quadrant, and also left lower quadrant. So what are the structures are there? So what we discussed just now, 9 quadrants, again is going to be the divided into the 4. Only if we divide the abdomen into the 4, so these organs are going to found in the, these are the 4 areas. So coming to the assessment techniques. So what assessment techniques we are going to use during the assessment of the abdomen. So the major assessment techniques are the inspection, auscultation, palpation, and percussion. So these are the physical examination techniques, physical like findings in the abdomen. So what we are going, so we are going to check according to the inspection and auscultation, palpation, and percussion. So we will do it one by one. We are going to discuss here. So first, we have to know about the some sites of the referred pain, referred abdominal pain. So what is that referred abdominal pain? So actually referred pain. So referred pain is nothing but is the pain which is caused by the irritation of the organ, but the pain location will be different. Or is maybe because of, see here. So if you see the example is a pancreatitis. So the location at the left upper trapezius, the pain will be here, but this is because of the pancreas. If the inflammation of the pancreas, they may chance to get the pain here. Or maybe in case of cholecystitis, or maybe it's the renal rectal lesions, or maybe because of the appendicitis here, so they may chance to get the pain in the umbilical region. So depends upon the involvement of the organ or depends upon the structures, but the pain irritation, the pain will be is a different place from the site of the injury. So that is called as referred pain. For example, if anybody having the uh, in case of a renal stone, kidney stones, if any stone, the kidney is located in the posterior and also below the T12 vertebra. So but they are going to feel the pain if they're having any pain in the kidney. So they are going to feel the pain in the back, as well as it's going to reach to the urate or inguinal region. It may refer to the one place to another place. So this is because of the radiating pain and also because of the referred pain. Radiating means throughout the course of the nerve, if the pain get the throughout the course of the nerve, so it is called as radiating pain. But in the referred pain, the pain is somewhere. For example, umbilical appendicitis is located in the is a lower like a inguinal region, that is the right inguinal region. But the location appendicitis here, they are going to feel if anybody having inflammation of the appendix, so they are going to get the severe pain in the umbilicus region around the umbilicus. So the location is here, but inflammation, the pain is going to be occurs at the umbilical region. So that is called as the referred pain. So we have to know, so which organ is going to give the referred pain, we are going to discuss here. So in the inspection, here we have to take some history about the health questionnaires. So here we have to check the change in the hepatite. So we have to take history from the person who are having the stomach abnormality or stomach pain or discomfort in the abdomen. So we have to check about the how is the hepatite. Is it going to be like a hepatite is a normal or anorexia? That means a loss of hepatite, or is maybe is going to be the if they are having always feel like a polyuria, polydipsia, and also if they are having like having the more like a eating sensation. So we have to check, and also is a usual weight. So how is the is change in the usual weight, difficulty swallowing. So and also we have to check the patient having any difficulty in swallowing. So how is the weight? So according to the weight, is there any changes? And also, are there any foods that you have the difficulty tolerating? Any foods are giving the discomfort? If sometimes if they have food something, is more make chance to give the discomfort. Who already have some gastric irritations. So those people are going to, if they have like a is a acidic food, so it may use the more acidic and also may chance to get the ulcers and also may chance to give the stomach pain. Or in case of if they have some people may if they have some spicy food also or maybe it's oily food also may chance to get the discomfort in the stomach. So those things we have to know about the food tolerant. And also next about the have you felt any nauseated? So we have to check. Some people they may chance to get the nausea, that is feeling of vomiting sensation, and also may chance to sometimes they may chance to get the burning and reflex, esophageal reflex. So maybe it gives the irritation and the burning sensation. So we have to check. And also, have you vomited or emesis? So that means any vomiting is there. So because of the any like a food poison, or maybe because of the any food, or because of the any stomach abnormality, any gastric irritations. So we have, and also any experience of the indigestions. We have to take the history about the indigestion. Indigestion means sometimes if they have food in the, like if they have breakfast in the morning at 9 o'clock, so if sometimes they may won't get the digest the food until the evening, or maybe if they have dinner in the evening 7 o'clock, some people may won't get the digestion until morning also. If they while having brushing, so sometimes the food particles also may chance to get it, or maybe if they got like a stomach fullness or also flat wounds. So this may the gas may be regurgitate. So in case of gastric irritation, if no improper digestion, it may comes upwards. They're going to feel the burning sensation and also irritation in the center of the chest also, or maybe in the epigastric region. And also heartburn and also pyrosis and blenching. And also in case of use the antacids, if so how often. So if some people having the heartburns, or maybe some of the is always is a bloating, like a bloating stomach fullness and also blenching. So this we have to ask about the status of the gastric. So how often they are going to use the antacids? Either is the gastric medicine, or maybe is the antacids such as the any like a syrups, or maybe any in case of tablets such as the pantoprazole or omeprazole, or some any particular syrups. So magnesium chloride. So these things we have to know how often they're using. And also abdomen floor feel bloated after the eating. Some people are going to immediately they're going to get the eating, that is a distension or any abdominal pain associated with the eating. And also alcohol use or in medication. So these things we have to take the history from the persons, because who already like having gastric irritations, if they take little amount of food also, the stomach becomes the fullness and distended. It may give the discomfort and also associated with the stomach pain. And we have to take the personal history of about the person, or the person having any habits of smoking and alcohol, and also any use of the drugs. So this, because this also it interfere with the food and also may chance to give the gastric pain, and also it gives the abdominal discomfort, especially for the alcohol who take the like a chronic like a alcohol person. If they take large amount of the alcohol, it may disturb the gastric function. So and also may chance to get the abdominal discomfort as well as the some complications. And medications such as the non-steroidal anti-inflammatory drugs. So these drugs are going to interfere with the digestion and also interfere with the HCl production. So it may produce the like a peptic ulcers. It may use the stomach ulcers. So that's why we have to know what are the personal history about the drugs and also alcohol and smoking. And also about the bowel habits, how the bowel habits. So is it the usual color and consistency, how the color will be? So that depends upon the person's diet and also persons what they are going to intake food. So sometimes if they take the different type of the color foods, also sometimes it may alter the like a bowel color, the feces color, and also any diarrhea or constipation or excessive flatulence. So diarrhea means is a loose motions or maybe stool passage. Constipation means difficult to pass the feces or maybe hardening or straining because of the improper bowel movement. And also excessive flatulence. So excessive flatulence means, so sometimes always they're going to feel the heaviness in the stomach as well as chest, and also they're going to burping many times, or they're going to feel the gas that come outside through the mouth. So that is the flatulence. So and also, or sometimes they may chance to get the how the gas is going through the anus. So these things are we have to know how much the, so how they are going to be release the gas. Is it going to through the mouth or going to through the anus, or is there any, are they using the any laxatives? So for example, in case of the constipations, so they have to use the laxative to that means to move the bowel, to improve the bowel movement and also to clear the bowel. So these things are we have to know from the persons who came for the investigation processes. And also we have to know the any abdominal history. So abdominal history, such as we have to know the any gastric problem, such as the ulcers and also hepatitis, any jaundice, appendicitis, colitis, and also hernia. Ulcers means any stomach like a damage, any irritation in the mucosa of the stomach. So if the chronic irritation of the stomach ulcer mucosa, it because of the HCl, high concentration of the HCl, it may damage the stomach mucosa and also it may produce the, and also it may give the ulcer injury in the stomach layers. So it gives the burning and severe pain also. So that's why we have to know any ulcers. Hepatitis, inflammation of the liver. Is it because of the infection or because of the any other complications, or maybe because of the alcohol, high alcohol intake? So in and also jaundice. So jaundice means is the also liver defects in case of excessive secretion of the bilirubin. So if there is no imbalance of the like a liver functions, so it may gives the jaundice. Appendicitis, inflammation of the appendix, and also colitis, inflammation of the colon. Hernia, hernia means the um, as a dislodgement of the internal organs, or maybe this is going to be inguinal hernia and also abdominal hernia. So if any weakness of internal organs or maybe intestine or displacement of the internal organs, so it may comes downwards, so it may use the bulge-like appearance at the abdominal area, especially in the umbilical area. So it is called as umbilical hernia or abdominal hernia, or sometimes is going to downwards, is going to the inguinal region, inner thigh region. They may chance to get the hernia that is called as the inguinal hernia. Coming to the surgical history of the abdomen, and surgical problems in the past. So we have to know the any history, previous surgical histories, or any because of the appendicitis, or maybe any kidney like a transplantation, any kidney disease, or maybe because of the any other like a gastrotomy, or the for the obesity persons, or maybe if anybody like a pancreas cholecystectomy, removal of the gallbladder. So we have to know what are the previous any history of the surgical procedures. Coming to the abdominal X-rays and sonograms, CT results, and colonoscopy results, etc. So we have to check about the previous any other any diagnostic procedure, investigation procedures. If they're having any X-ray reports or any ultrasound scans, CT scan reports, and colonoscopy results. So according to their signs and symptoms, with the physical examinations, through the history and auscultation, and also inspection and observation. So all these things. So we have to add these diagnostic procedures. So we have to give the conclusion about the conditions. So and also assessment in the abdomen, we have to check for the skin changes, umbilicus, contours, and also observable masses and movements. So in the assessment of the abdomen, we have to check all these things. So if you see in the performances, so in the preparation prior to the performing the procedure, check the doctor's order for the need of the perform the assessment. So we have to check for the what is the importance of this assessment, and also assessment of this performance, and also we have what is the importance of the examinations. We have to clearly explain to the persons, and also perform hand hygiene. So before examine the patients, so the physicians and also clinician has to sanitize and also maintain the proper hygiene, applying the gloves, observe other appropriate infections, so and preventive procedures, prepare the equipment needed for the assessment. So what are the preventive, like what are the equipments is needed for the assessment? So we have to collect it and for the assessment purpose, and also introduce yourself, and also verifies the client, identify using the agency protocol. Sometimes we have to introduce properly, and also we have to ask their name and also their details properly, and explain the procedure to the client, how he or she can participate, especially about the need to assume several positions for the exam. So while doing the assessment, we have to explain clearly what procedure we are going to do, how we are going to ask them to change their positions, which position is going to be checked for the which type of organs we can found. So we have to clearly explain to the client, and then only we have to start our assessment plan. So next about ask the client to empty the bladder before beginning the examinations. So that means if the person comes to the like examination room, first we can ask them to pass the urine and also to empty the bladder. So if after bladder empty only, then we can examine clearly. Otherwise, if the bladder is distended, so maybe it maybe it can give the like a misdiagnosis. Ensure that the room is warm. Instruct the client to remove the clothes and put on the gown. So if they come with like the special attire, or maybe if the any shorts, or maybe if the tight attire, so sometimes it's not suitable. So ask them to remove the dress and also put on the gown. So it will be helpful to do the examination clearly, and also help the client to lie supine with the arms folded across the chest, or sides. So ask them to lie on supine lying positions. If it's a cross chest, or maybe side, and also keep the sides aside also, no problem. And also place the flat pillow under the client head for the comfort, and slightly flex the client's legs by placing pillows or rolled blanket under the client's knees. So we have to give the relaxation positions. We have to keep one pillow under the knees. This is going to be give the some relaxation while examining the patient. So drape the clients with the sheets so that the abdomen is visible from the lower limb rib cage to the pubic area. So we have to ask them to expose the area. So the remaining exposing area, we have to keep it in exposing. The remaining parts we have to cover with the drape sheet to give the protection or to give the privacy to the client. So it will be good assessment plan to give the privacy to the their pubic area. So, or maybe in the breast, if the female, we have to cover the remaining upper part of the breast as well as the pubic area. So the remaining should be exposed. So these are the positionings, and also instruct the clients breathe through the mouth. So while doing these things, ask them to take the deep breath, and also the advice to take slow and also deep breath. So this one is going to provide the So, this drape sheets are also going to be the provide the privacy, and these things are going to be helpful to where they're having the abnormal masses and also any distension we can find out. And also assessment of the abdomen, any incidents of the abdominal pain we have to find out. Tender areas, if any tenderness pain, what is the location of the pain, onset of the pain, sequence, and also quality, frequency, associated symptoms. Is there any constipation or diarrhea, any change in the appetite, any food intolerance, or any food indigestion in the past 24 hours. So while assessing the abdomens, we have to take all the information. So then only we can conclude the diagnosis. Then only we can get the clues according to the signs and symptoms. Assist the clients in supine positions with the arms placed comfortably sides. Place the small pillow below the knees. So this position is the suitable to do the inspection of the abdomen. So in this one, the patient is going supine lying. Just we have to place a one pillow under the knees. It will give the complete, the back is going to be complete rest. Slight flexion of the hips and knees. It will give the less curvature in the lower like a lumbar region. So it will be comfortable to the patient. So inspect the abdomen for the skin integrity. So color of the skin, vascularity of the abdominal skin, and also strays, scar, lesions, and rashes. So these things we have to inspect. And also what are the abnormal findings? So is the unblemished skin, so and also uniform color, silver white strays, that is the stretch marks, or any surgical scar. So the normal is if in the female, so most of the times after the pregnancy, so they may chance to get the white strays, that is the stretch marks, or maybe any surgical scar in case of any cesarean surgery. Or for the male also, if they undergone for any surgical procedures such as cholecystectomy, or maybe is any other intestinal disease, any like a gastric surgeries, so we can found it. So those are the normal things. So the skin color also is going to be uniform. It's not should be dark or maybe color changes or maybe sinus. So these are going to be abnormal. So should be the equal color, uniform color. And also contour, symmetry, and umbilicus and skin. So we have to check this one. So how we are going to check this one? So we have to check the any deviation from the normal. So any deviation means we have to check for the any rashes. So is the how the is it the lesions are the tense and also glistering the skin. So is going to be any like a shiny appearance in case of ascites or maybe in case of the edema. The tummy is going to be like a shiny and also distilling. And also purple striatus is associated with Cushing diseases. So you can see the purple striatus. So this commonly seen in case of if anybody having the any hormonal imbalance. So especially the steroid hormone, cortisol, if it increases the level of the cortisols in the blood, so because of the if any tumor in the pituitary gland, so if it is any problem in the adrenocorticotropic hormone, so it may chance to get the blood, the weight is going to be increased, the hormonal imbalance may will get. So because of this imbalance, so they may chance to get the pinkish is the stripe, purple or pinkish is going to be, they may chance to get the lines as the marks are, we can get found it. In the supine lying, how we have to check? We have to check for the symmetry of the stomach. So how is it a flat stomach or is it rounded stomach or is scaphoid, that means the concave one, or is it protruded, is it convex one? So how it's a concave means the shallow one or convex means it's going to be like a swelling, like protrusions. So we have to found. So sometimes these things also we are going to any abnormal masses we are going to found out. So we can with sometimes if the person lying position, the masses will be different in the sitting position or standing position. In case of like a hernias, abdominal hernia, if they sit, if they lying position, sometimes we cannot find through the inspection, we cannot find the bulging of the any internal organ. But if they stand, we can feel any like a rounded mass in the abdominal. So maybe because of the abdominal hernia. If we observe in the inguinal region, so above below the like above the suprapubic regions, so it may indicate the inguinal hernia. And also we have to check for the flat and rounded one convex, scaphoid one is a concave, and also any distended. So how the is any bulging or protruded. So we have to check all these things. So ask the client to take the deep breath and hold it. So if we ask them to take the deep breath and hold, so here we are going to found any masses, any abnormalities, we are going to found it. So such as any like hepatomegaly or splenomegaly, in case of enlargement of the spleen and also liver, so we can found it if they take deep breath and hold. So because of the enlargement, so we can feel that the mass is outside, so bulging. So if there no evidence of enlargement of the liver or spleen, the normal one, no evidence. Abnormal means if any enlargement of the liver or spleen, so it is called as the hepatomegaly and also splenomegaly. And also assess the symmetry of the contour while standing at the floor. So we have to check for the symmetry at these things. We have to check we check the contour, the size we have to check it. So where exactly? So is a asymmetric contour. So we are going to found the localized protrusion around the umbilicus or inguinal ligaments or scars in case of hernia or tumor. If any extra abnormal mass inside the stomach, if you take the measurement tape, if you measure, so for the right side enlargement is there. So right side is going to bulge is more than the left side. So we have to compare the right side or left side where they're having the bulge or mass. So we have to check the proper like a assessment at the size of the abdomen. Where exactly we have to put. So this one exactly is should be both sides are should be in the center of the umbilicus. So that is we are going to found any masses around the umbilicus such as the inguinal hernia and also abdominal hernia. If a distended is present, measure the abdominal girth by placing the tape around the abdomen at the level of the umbilicus. So if any extra masses, so we have to use the tape, so where they're having the like enlargement. Coming to the inspect the abdominal like a movement when the client breathe in. So there that time we are going to, if the breathe in, so we are going to found the normal respiratory movement, or may also we can found the observe iotic pulsation, observe for the peristaltic waves. So these are the we have to find during the inspiration, so during the inspection time. So here the normal findings are symmetric movements caused by the respiration. So normally if they take the deep breath, the right side and left side should elevate the same time, the symmetrical movement. So, and also visible peristalsis in the very lean people, and also we are going to see the iotic pulsation in the thin people at the gastric levels. So they are going to find in the thin people, so these are going to be normal. But in case of abnormal, so the limited movement due to pain or decreased process. So normally the symmetrical movements, right side and left side. So if anybody having any like a distension in the liver because of the like a liver cirrhosis or liver enlargement, so that time, so this may like a movement will be different to the right and left. So then where we can understand, so this right side having the problem. No visible peristalsis. So no, the movement, there is no proper movements. So maybe because of the bowel obstruction. And also is a marked iotic pulsations. So it's going to be, they may chance to get iotic pulsation. So these will be the abnormals while checking the inspection, while doing the inspections, we are going to found in the, that means the abnormal, like a limited movement. So due to because of the pain or if any inflammation also, they are unable to take the deep breath. If the deep breath also, the organs are going to be stretched, they may chance to get the severe pain. And also observe the vascular patterns. So how the vascular pattern is there? Is it the normal one? No visible vascular pattern. So that means we cannot find the veins on the stomach or abdomen. So we normally, we cannot find that much. But in case of abnormal, so it is going to be dilated or distended of the veins. So this is commonly found in case of the, if anybody having the liver cirrhosis. So liver cirrhosis, liver damage, and also ascites is a accumulation of the fluid in the peritoneal cavity and the stomach region. So is the excessive accumulation of the fluid. So in those conditions, the veins are going to be dilated and distended. And also venocaval obstruction. If any obstruction in the venous or any like a veins, if any obstruction or any thrombus formation, or is there any obstruction of the any with the tumors or any blood vessel damage or any like a thrombosis. So also may chance to get the this venocaval obstruction, if any complete obstruction, any extra growth or any compression or narrowing or stenosis of the venal like a veins, so may chance to get the this type of complications. Then auscultation of the abdomen. So how to do the auscultations? So auscultation means how we are going to check the, with the stethoscope, we are going to hear the sounds in the abdomen. Everybody thought that I think only auscultation are we are going to use the stethoscope only for the heart sounds and also lung sounds. But with the heart sound, with the stethoscope, we are going to find the bowel sounds, and that is called the abdominal auscultation. Auscult the abdomen for the bowel sounds is a vascular. So this is going to be the vasculars, bowel sounds, and also peritoneal friction ribs. is to warm the hands and also the stethoscopes of the diaphragm. So that means we are going to, where we are going to palpate. So we have to warm the area and also we have to place the stethoscope. Then we are going to find the bowel sounds, vascular sounds, and peritoneal friction rubs. So these are going to be because we are going to auscultate during the assessment. So normal one is audible bowel sounds only. So in the normally we are going to heard about the bowel sounds, no vascular sound, no peritoneal friction rip. So these are going to be abnormal. Only bowel sounds are going to be normal. So if anybody heard about the vascular sounds and also peritoneal friction rub, so it indicates the abnormal one. So the deviation from the normal. So the abdomen, this is the audible sound is it because of the hypoactive. So sometimes it's going to be less audible, or is a hyper is more, or sometimes it's going to be increased or absent. So these are the some deviations from the normal. So we have to assess why this because of the is a less or maybe absent of the bowel sounds. So use the flat disc diaphragm. Is the intestinal sounds are relatively high pitched and also best estimated by the diaphragm. So with the diaphragm of the diaphragm of the stethoscope, we are going to found this bowel sounds. Light pressure with the stethoscope is adequate. No need to put the more pressure. No need to press into the intestine and the stomach. Ask when the client the last time or when when he or she ate the food. So it may alter the bowel movement or bowel sound depends upon the intake of the food also. So that's why we have to know when they had the last meal or maybe anything is a meal or snack or whatever the food they had. So we have to know at what time the difference between the checking time and how much time is before the checking time. And also place the diaphragm of the stethoscope in each four quadrant of the abdomen. So we already know that the quadrants out of the four abdomen. So right upper quadrant and also left upper quadrant, right lower quadrant and right is the left lower quadrant. So this is going, if you divide the abdomen is a four directions, right upper quadrant and right lower, and also left upper and left lower. If you divide the four parts, is going to divide the four sections. So listen for the active bowel sounds. Any irregular gurgling noises occur about every 5 to 20 seconds. So we are going to have to heard about the active bowel sounds, and also if sometimes because of the bowel movements and also irregular sounds may chance to get 5 to 10 seconds, 20 seconds. And also we have to heard about the vascular sounds. So these will be vascular sounds are going to be different vascular sounds we are going to found during the auscultations. So it will be over the stethoscope, over the aorta. So at aorta, so this place is going to be can heard about the aorta. So and also next about the renal arteries, is the femoral arteries, iliac arteries. So if you know the surface anatomy, so where to place the diaphragm of the stethoscope, so that place we have to place it, and also we have to heard about the aortic sound and renal sound, renal artery sounds. So these are the vascular sounds we are going to found in the abnormal, but these are the not normal. If anybody having any pressure or any damage or any like a hypertension, so those conditions are maybe is the thrombus formation. So we can any distension, so we can found this type like a vascular sounds at these places. Okay, listen for the broods. So listen for the broods means, so the absence of the arterial broods. So normally, if while checking, normally there's going to be absent aorta, the sounds are going to be absent and renal artery. So all these parts going to be absent. But in case of, this is the normal, but the deviation is the loud brood over the aortic area. So that means if you heard about the sound in the aortic regions, so in the epigastric levels, so this is going to be epigastric level, if any heard about the aorta sound, it indicates the aneurysm. So what is mean by aneurysm? So aneurysm is nothing but abnormal dilatation of the blood vessels. So if any dilatation in the beginning, big size, the become the distension of the blood vessels, or it may become weak and may chance to get the burst, it may give the hemorrhage. So this is going to be abnormal aortic like a broods are going to be found in case of the possible aneurysms. So that is maybe we can heard about the epigastric levels. And also is about the peritoneal friction rubs. So these peritoneal friction rubs are nothing but is the rubs are rough and also grating sounds like two pieces of the leather rubbing together. How the leather rubs sound, how we are going to feel the sound if the pricks, if we rub the two leather pieces, the same thing we are going to heard in the peritoneal with a stethoscope. So if anybody having this peritoneal rubs or friction rubs means it indicates the like abnormality. So should be normally absence of the friction rub should be the normal. So if it's abnormal means the friction rub is going to be is going to occur. So that is about the friction rub. So coming to the percussions. So where to percussions, so and how to do the percussions, what is the importance of the percussions. So several areas in each of the four quadrants to determine the presence of any tympani and also any dullness. Use the systemic pattern. Is a percussion. So percussion means we have to use the left hand and also left hand fingers. Then we have to percuss all over the area of the abdomen, and also we have to use it in a systematic manner. So the direction how we have to do, so we have to do from the distal to proximal and then to the distal. So these directions we have to follow how the arrow marks are passing. So if you do these percussions, so if anybody having any dullness or maybe if any hyposensitive or maybe is the resonant, so we are going to found the tympani of the abdomen, or maybe we can easily find. So according to the sound, so we are going to conclude the condition. So normally tympani over the stomach and also gas-filled bowels. So tympani means like a sounds. So it's going to be found in the over the stomach and also gas-filled bowels are going to give the tympani sounds. That is a normal. Dullness, especially over the liver, spleen, and full bladder. So these are the normals. So dullness we can found in the abdomen, but especially the organs such as the liver and also spleen, and if the bladder is distant, the bladder is full with the urine. So in those conditions, so is we can found the dullness. So this is the normal. How is going to be, how we are going to differentiate to the abnormal. So in case of the large dull areas, so large dull areas, normally we are going to find the spleen and also next about the liver and also bladder. But other places also, if they're having any dull areas, if the presence of the fluid or tumor, so if the dull areas, we can think about so if this dull is because of the either fluid accumulation or either because of the tumor. So we have to know what is the causative factors. We have to found it. Coming to the medical percussion sounds, so this will be the three different types of the medical percussions. Resonance, so this resonance heard over the lung tissues. In the lung tissues, we are going to find the resonance, and also tympani, we are going to find in the abdominal cavity. The sound which we are going to heard in the abdominal, so that is going to be called as the tympani, and also dullness over these organs such as the liver and also muscle. So this is going to be found. So these are the normal medical percussion sounds. So that means if anybody having if for example, if on the liver, if less dullness or is the resonant means, so we can think about this abnormal. For example, in case of if the tympani occur in the lungs, so it may be abnormal. So that's why we have to compare what is the normal one and what is the abnormal one. So then we can easily conclude the diagnosis. So percussion, where to start in the percussion? So start the liver, begin in the right lower quadrant. So this is the right lower quadrant. And also where we have to start is a mid-clavicular line. So we have to start the mid-clavicular line and percuss upwards. Note any changes from the tympani to the dullness. So from the lower to and also up, we have to transfer. So just now we discuss here. So how the percussion is there. So we have to start from the lower quadrant and also we have to until upwards. So is there any abnormality? So we have to find out. So that is exactly in the right lower quadrant in the mid clavicular line. So mid clavicular lines mean, so it is the clavicle. If you take the clavicle, if you draw a line from the vertically downwards, so exactly should be cross intersect the clavicle into two separate, like a two halves. So that is called the mid clavicular line. So this is the important. So if you check this like a percussion techniques, so we can find the way having the dullness and way having the high resonance. So perform the blunt percussion on the liver. Percuss the liver by placing the left hand flat against the lower hand and also lower right hand to the rib cage. So you have to place the hand here, and also especially here is going to be blunt percussion. So we have to go into the blunt percussions with the with the ulnar side of the right hand. Fist we have to strike over the left hand. If you type here, so what sounds we are going to found. So this the dull or is going to be resonance. So that is the percussion method. And also percuss the big spleen begin the posterior to the left middle axillary line. So with the liver spleen, we have to do in the posterior to the left mid axillary line. So if the left side mid axillary line, the posterior side, we have to do it the left mid axillary side to check for the spleen enlargement. And also the percus downwards. From here is going to downwards for the spleen. For the liver is going to be the upwards. For the spleen is going to be the downwards. So coming to the percussion of the kidney, so this percussion of the kidney also, where we have to check at the palpate, and also we have to percuss at the costovertebral angle. So costovertebral angle. So there, where exactly costals means the ribs, and so vertebral. So where they are going to be the angle formed between the ribs as well as the the vertebral vertebrae. So there we have to percuss properly. So here also we are going to use the over the 12th rib, we are going to use using the right, using the ulnar side of the right fist to strike the left hand. If you place the left hand, so we have to strike it, or we are going to give the a blunt percussion. So that is the special techniques here in the abdominal examinations. So if any abdominal any different sounds, so we are, if you are dullness or maybe resonance, so depends upon the involvement, so it may use the sound. So that's why we have to percussion should be, the percussion method should be accurate, and also it will give the conclusion of the diagnosis. And also palpations. So we have to palpate the abdomen. So these palpations are going to give the clues about the any tenderness or any any extra growth, any masses in the abdomen. So then we can easily understand is because of the mass, any tumor, or any presence of the hernias, or we are going to found, or is there any tenderness. So these are going to we can found. Place the patient is a back to supine positions and perform the light palpation over the quadrant of the abdomen. So we can ask them to supine lying position. In the supine lying positions, according to the places, the quadrant, 4 quadrant. So we have to place the hand and gently apply the pressure, and also we have to palpate throughout the 4 quadrant areas. Perform the light palpation first to detect the areas of the tenderness and also any muscle guarding. So that means if there any tightness or maybe any tenderness, and also systematically explore all the 4 quadrants. So here we have to check all the 4 areas. So we have to check the systematically. So hold the palm of your hand slightly above the client's abdomen with your fingers parallel to the abdomen, and depress the abdominal wall lightly about 1 centimeter or depth of the subcutaneous tissue. With the pad of your fingers, move the fingers pad in slightly circular motions. If you use your the fingers and thumb pads of the fingers, so place the pressure slide like a gentle pressure until the 1 centimeter, the depressions, we have to place it, we have to place all the areas of the 4 quadrants. So upper right quadrant, and also lower quadrant, right quadrant, and also upper left and also lower left. So these things, all 4 quadrants we have to apply, we have to give the pressure throughout all the quadrant area. So note any areas of the tenderness or superficial pain or masses or any muscle gardening. To determine the areas of the tenderness, ask the client to tell about them and watch for the changes in the client's facial expression. So if you press, so if you need tenderness, they won't get any pain in the normal time. But if you press the pain, so because of any inflammation or may chance to get the pain, and also we have to observe how they are expressing the pain. So that means how the facial expression, so how they are withdrawing. So these things are how they are going to give the jerky movements. So these things are we have to observe. If the client is excessively ticklish, so begin by pressing your hand on the top of the client's hand while pressing lightly. Then slide your hand on the client's and also on the abdomen, continue the examination. Sometimes they may feel the discomfort or maybe ticklish. So that's why we have to first bring them into the normal, like a sensation without ticklish, then only we can do our examination. And also we have to palpate the spleen. Stand the clients, ask them to stand, also client right side, and also reach over the abdomen with your left arm. Place your hand under the posterior lower ribs. So pull up gently. So here we are going to do this one, the posterior side here, the midclavicular region. Place the hand into the deeper side, the right, left lower upper quadrant. So this is going to be inspect that we are going to palpate, and if anybody having any like a tenderness or any mass or maybe is enlargement of the spleen, we are going to found in these positions. Place your right hand below the left costal margins with the finger pointing towards up, so towards the client head. So we have to place upwards, we have to squeeze in the circular directions, we have to give the pressure. So ask the client to inhale and also press inwards and upwards as you provide support with your other hand. So we have to give the support. Here we have to give the support and also give the pressure. So we have to stabilize and also support and also ask them to breathe in. So if they breathe in, what happens is lung is going to be expand. If any enlargement in the spleen and also is going to give the difficulty in the movement, may chance to get the tenderness. So that's why we have to, while examining, we have to ask the persons to breathe in and breathe out in the relaxed manner. So it is going to give the clues for the diagnosis. So ask the client to inhale, press upwards and also inwards and upwards as provide support with your hands. Be sure palpate your fingers below the costal margins. So do not miss the lower edge of the enlarged spleen. So sometimes if we miss the lower edge of the enlarged spleen. So that's why we have to ask them to breathe in and breathe out, and slightly we have to increase the pressure in the upwards towards the head side. So here in all the directions, in the four quadrants, we have to check. So here in the epigastric regions, so we have to palpate the aorta. So epigastric region, we are going to palpate the aorta. And also bimanual technique for the liver function, as liver palpations. So we have to use the opposite, like a left hand under the like a back, and also right hand we have to keep it over the liver regions, and we have to palpate. This is called the bimanual. Both hands are going to use. And also is a hooking technique for the liver palpation. So this hooking technique is going to use in case of cirrhosis of the liver. So this one we are going to find any enlargement in the liver. And also for this one is just now we can use the bimanual also both hands, but one hand we are going to give the support. We have to fix it, we have to pull it up. Then only if you give the squeezing, and also we can palpate spleen easily. So if any enlargement, we are going to find out. And also about the kidney palpation, to palpate the right kidney and also support the right is the posterior plank with the left hand. So place the right hand on the right lower quadrant. So like this one, we have to place our left hand under the like a back, and also one hand place this over the kidney area. So these are going to be find any enlargement, and also exactly we have to keep the pressure in the mid clavicular line. So if you draw a line from the middle of the clavicle, so we are going to point it here, intersecting here. So this is for the examination of the liver, kidney. So next one is to capture the kidney, ask the client to inhale and compress your finger deeply during the peak inspirations. So if they take the deep inspiration, so because of the expansion of the abdomen and also lungs are going to give a little bit more pressure on the any masses or any enlargement. So it's going to give the clear informations. And also ask the client to exhale and also hold the breath briefly. So if you ask the clients, if you exhale, gradually release the pressure on the right hand. If you have captured the kidney, so you will feel the slip beneath your fingers to palpate the left kidney is going to be reverse procedure. Why this I have to do? Because of the left and right kidneys are going to be slightly, so change the positions. So there's going to be right and left is going to be slightly, one is going to be up and another is going to be some small down. One is here, one is here. So that's why we are going to feel this much of difference. And also test for the appendicitis or peritoneal irritations. So appendicitis means any inflammation of the appendix or any peritoneal irritation or any obstruction or maybe any inflammations. So these things we have to palpate in appendix regions. So in the right inguinal region, so above the suprapubic region, so we have to found it here. So palpate deeply at the 90 degrees into the abdomen, halfway between the umbilicus and also anterior iliac crest. So this is the anterior iliac crest, so hip bone, and also in between the umbilicus. So in between exactly we have to palpate. So there if we give the pressure 90 degrees, so there if any like inflammation, so we can easily found any like inflammation or swelling. So it may chance to get the tenderness, they feel the severe pain. And also then suddenly release the pressure. So if you check like this one, so we are going to identify if any swelling and also any tenderness. Palpate deeply into the lower left quadrant and also quickly release the pressure. So we have to check for the right as well as left. So to compare, are they having any pain or any like a tenderness? So we have to check. And also we have to assess the psoas sign. Psoas sign is going to be, so that is the psoas muscle. So this muscle is going to be like a inflamed or is may chance to get the irritation. So in case of the, if any like a appendicitis or peritoneal irritations, so that's the reasons. So we have to check the, uh, we have to check the, it's a special test. This is psoas test. Ask the patient in the sideline positions. So we have to bring into the extension position of the legs in the sideline. So why? So the main function of the psoas muscle is that helps in the hip flexion. So what happened if you do the extension movement, hyperextension of the movement, it may gives the irritation to the psoas muscle. So it irritation of the psoas muscle indicates the any inflammation of the psoas muscle. So we can give the clue about the any appendicitis or any inflammation, as well as in case of any peritoneal irritations. So this is the special test to know the any like a peritoneal irritation or also appendicitis. And also another test also we can do obturator sign. So this also going to be support the clients in the right knee to the ankles. So this one is we have to ask them to the flexion of the right leg and rotate the hip internally. So if you do the internal rotation, if you do the flexion, hip flexion and knee flexions. So if you do the internal rotations, so that means the head of the femur is going to be rotated internally. So he's going to get the obturator internus. So operator, the muscle is going to get the irritations. So this is most commonly seen in if anybody having the peritoneal irritations. So these two signs are the major signs to identify the if any appendicitis is there or not. So inflammation of the appendix, so it may give the irritation to the pelvic region. So these special two tests are going to be is evaluate the appendicitis. So these are going to be how to do the psoas test, sideline position, extension positions, and also operator test. We are going to do the internal rotation of the hip. And also next, the perform the hypersensitivity test. So after ensuring that the patient is in the supine lying positions and also bring to the neutral positions, stroke the abdomen with a sharp object. So if any sharp object, if you stroke on the abdomen, so they are going to get the severe pain. So that is for the about the appendicitis assessment. Or in case of any cholecystitis, any cholecystitis means inflammation of the gallbladder. So here we have to ask them to the patient in the supine lying positions. In the supine lying positions, ask the patient should be relaxed, and also we have to place the both hands and give the pressure in the under the liver border. So the right costal margin. So ask the patient inhale deeply. So over below the liver, if you press the like if you give the pressure while doing the inhalations, so they are going to get the severe pain. So that also test for the cholecystitis. And also next for the palpation of the bladder. So our palpate the area above the like a pubic symphysis. So this is a pubic symphysis. So here we have to palpate above the, these are the hip bones above the pubic symphysis. So there we are going to found the like a bladder. So it's going to be, if the client history indicates the possible urinary retention. So that means if you press, we can understand if the bladder is a normal tone or abnormal tone, or maybe is the or maybe distension. So then if the bladder is full, like a distended, so we can easily understand. So this palpation will help to like evade the having the any extra masses or maybe any tenderness or any swelling. And also next about the inform the client about the end of the assessment and show the gratitude for the participation and cooperation of the patient, and ensure the patient is the stable conditions before leaving the patient room. And also after that also we have to perform the hand hygiene. So these are the special techniques. So these techniques will help to identify the what the problems they are facing, what are the complications with the abdominal, the abnormalities are we are going to find with this the like a physical examinations. So after what we understand and also what we identified, so in the patients what we observed, so everything should be documented. So documentation finding the client record is using the printed or electronic forms. Our checklists are supplemented by the narrative notes when appropriate. And also inform the healthcare providers for the any untowarding the findings. So that means if any related, if you find anything, so we have to note it clearly and we have to document it. So this documented is going to give the clear information about the patient health status, especially for the any abdominal abnormalities. So either any masses or maybe any hernia, any inflammation, any hepatomegaly, any splenomegaly. So we are going to understand about the all the information. So these are the principal like a inspection and also the principal investigation procedures or diagnostic procedures for the physical examination procedures for the abdomen. So this is that's all about the abdominal examinations. So hope you understand clearly. So that's all about today topic abdominal examination. That's all about. If you have any doubts, anything regarding the abdominal examinations, so you can give me a message so I can clarify about your doubts. Thank you very much. See you in the next class.